Welcome to Movie Podcast, blah, 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 blah. We're in the middle of a conversation. We hit record. We're talking about pelvic mapping and masturbation.
Yeah.
Well, and pleasure that could lead to this, but also pelvic mapping that can lead to understanding and reducing pain and symptoms. This is fascinating because I asked her. I got all this shit. All these pages of shit and questions. I told her, we may not get to.
I was like reading the questions. I'm like, haven't we already talked about this and answered this and like other things?
Yeah.
I'm sure we have.
Yeah. But we haven't done podcasts long form.
No, we have not.
But the point is, these might not even. I don't even know if we're gonna to get into this because I asked her what she's interested in right now. Dr. Brittany Ellers.
Hi, everyone.
Pelvic floor physical therapist, incredible. We love her. She's our preferred person for pelvic floor. You've seen her in all of her videos. And she loves this shit. She lives and dies.
I breathe
pelvic
it.
Floor,
I breathe it in, breathe it out.
Vaginas inside and outside of all this stuff. So, pelvic mapping. Yeah. Let's continue this.
Yes. I mean, for me, pelvic mapping has changed so much for myself, my body. And what I was just telling you off recording was that I just did like a 6 workshop series and it touched on all these aspects of pelvic health, like bathroom basics, like becoming a mother, other things like sexy cycles and really getting into the menstrual health and how that is impacted by the pelvic floor and vice versa. Yeah, vice versa. Exactly. It's just like all the aspects of it. And even just simply knowing your anatomy and your physiology. And really at the crux of it was this practice of pelvic mapping, which I do with my one-on-ones all the time. Like I'm doing it personally, right, with a gloved finger, and I'm helping them go through at different depths as well. Like
and you got the clock, right? It's kind of like the clock system.
Exactly. Like pubic bone is 12 o'clock, and then tailbone 6 o'clock.
Yeah.
Left and right sits bones are 3 and 9.
Okay.
So, I mean, we can talk like if this is some one person, right, then this is the right side, 3 o'clock, and then the left side is 9 o'clock. That's how I kind of go about it. I'll start just like in the center, not with like a super deep finger or anything like that. I actually, this is my personal preference, but like I wait for the pussy, the yoni, the pelvic floor just to relax and soften with my presence there. And then
how do you
accept me?
Oh, I might be missing that cue.
She sucks you right in.
Really?
Yeah.
So you just kind of wait with some pressure?
I do wait. Like literally just with like the presence of my finger, 5 milligrams, whatever, of pressure.
Yeah.
Like a nickel on your forehead kind of pressure. Okay. And I just wait for that. And then I start working around in a clockwise, whatever fashion.
On the outside.
Uh-huh.
And this is what women would do with themselves as well.
Correct. Yeah.
Partner, self.
Yeah, absolutely.
Okay.
I'd say self, partner, practitioner, like any provider should maybe hopefully have the chance to take this kind of time, because depending on what someone's dealing with, they could be experiencing a lot of that pain that we were talking about. You know, they could be experiencing a lot of like spiciness.
What were we talking about?
I mean, vaginismus, any kind of pain with penetration, whether that's initial or deep. They could be having any kind of vulvodynia, which is just like pain around the vulva, which is all the like external genitalia. I mean, even just scar tissue after having had a baby vaginally, or even at the cesarean scar, like those places can feel a little spicy.
How many women generally have pain in and around the vagina?
I want to say like 25%. I don't know off the top of my head what that.
It's quite a bit.
Oh yeah. Oh yeah.
And so you're saying like you're part of the palpation. You're like on the outside, and you're going like maybe like some coconut oil or something to kind of, and then you're kind of like working, like feeling the outside.
Oh yeah. I start like personally. So when I lead these mapping sessions, I was going to say, right, the crux of all the things that pelvic health really impacts, like your sex life, your bowels, your bladder, all of that. It comes to the point of like, do you know your anatomy? Do you know how you feel? Do you know like what is actually tender, what isn't, what feels good? So when I start, I'm starting like actually really high up on the pubic mound. And when I guide it for people, and I do this virtually, I guide just hands, I guide just wands. But of course we use our hands still in the wand classes. I have them go just like working the tissue on the top, like around the fat pad, like because we want to make sure all of the tissue from like everywhere, right? Shoulders down, neck down, that like moves. So it includes right here over the pubic mound.
Also kind of getting comfortable with themselves or another hand.
Exactly. Like staying external, because we don't want to like, I mean, if you're having sex with someone and you don't want to have penetration right off the bat all the time, right? Like you need that little buildup, especially in a female body. Physiologically,
It's helpful too.
And it feels better for you, doesn't it?
Yeah, it really does.
Yeah.
It requires patience, but you wait long, and it's always worth the wait.
Exactly. I feel like just patience, it rewards you.
It does, and it's something I got to remind myself every day with.
I mean, same with women though, right? Like when you think
At
about
least a better experience too, and allows them to get a little wetter and more into it, and more because the arousal is much longer than us.
25 to 40 minutes.
12 seconds maximum.
I know.
For me.
I know. The blood flow to the vulva is slow. It's slow, but yes, I feel like there's a benefit to that, right? There can be all this chance and all this time to like be intimate with yourself and just like work into it and like have it slowly build up, because then when you do that gradual build up, it's like an even bigger explosion, you know what I mean?
Sure.
For like your climax, your orgasm or whatever. But like I think about a lot of women who come to my practice too, and I used to be like this as well. It's like, oh, you're just going to grab your vibrator straight off the bat. And even when you have sex with yourself, you're just going straight for the clitoris and staying external. You're
Is that
not
what most
exploring
women
internal.
are doing still?
I don't know about most.
Yeah.
I'd say, I mean, maybe it's 50-50. I haven't taken a recent poll on
Yeah.
my followers or anything like that.
We can run that poll on movie.
Yeah,
I'm going to have you
let's
ask the
run the
question,
poll.
though,
Okay,
okay? I don't want there to be confusion.
But yeah, I do feel like it's a big phenomenon, especially with just vibrators being so like, available.
Yeah.
But that's why I've kind of like I've led towards more using like wands, because it is a slower practice, or using your hands and like resensitizing yourself to slower touch.
When would you use a wand versus fingers?
I think that just depends on the person. I'd say I'd start with hands, because also our digits are a little bit more, they're smaller
Yeah.
than maybe say like a regular kind of sized wand that you're thinking of that might be like penis shaped, penis sized. But there are some wands that do come in like a smaller diameter, like for rectal care. You kind of want to start small there anyways.
Sure.
Right? But
So you'll start with maybe hands just to get comfortable, and then do you find that, there's limitations to the fingers internally, right?
True.
Angles to even find. How do you get
Exactly.
the bottom? I need massive external rotation of my shoulder.
Exactly. I don't like, even for me, when I'm working with clients, like my finger doesn't get to the points that I really need to get to. Like I can't reach the piriformis internally,
Right.
which you can. But if you have a wand that's long enough and you have that little bit of a curve, so like there are, some that are angled just like in a scoop, or there are some that are actually S-shaped, which then you're kind of getting to play with some leverage, and you just get to almost like you're pulling a lever. You're getting into those deeper points
You can
down towards the bottom.
like a crowbar.
Literally, it's literally like a crowbar.
Yeah.
But I don't want to.
It's not a good word to use. But
Yeah.
you also said obliterate pain, so I don't know, Brittany. There's a little
dissolve. It's
dissolve.
dissolving. Yeah.
Dissolve.
We're
pain.
dissolving the tension. We're dissolving the pain.
So this makes sense. It's kind of like palpation, for example. Maybe like if I'm feeling someone's low back, I'm going to feel with my fingers and I'll feel a tender point. And then I could use something like a Theragun because I've already sensed it with my finger and I know where it is. But you're going in with something, a wand.
Yeah.
You may not, well, I guess as a practitioner, it's more difficult because you can't feel it. But if you're
Right.
using it on yourself, you can definitely.
Right. The interoception is there.
Interoception.
Yes. You can feel where you are in space and like what's touching you from the inside, if that makes sense.
So now we get in this thing, right? Like, what is, like, listen, I guess maybe you could take us on a journey from the outside, the vulva area, into the vagina in terms of the points, and then maybe like what one can find at each point. Like at 12, what's there?
Yeah. At 12 o'clock, if you're going like just superficially or even just like 1 to 2 inches deep, you're probably actually feeling more of that sponginess, right?
Where 12 o'clock for everyone out there is going to be more pubic symphysis.
Right.
That's if someone's laying on their back, you
Yep.
go in and straight up.
Right.
Okay,
Exactly.
okay.
Exactly. So if the finger pad is facing up and you're touching on kind of like 12 to 1, back to 2, and kind of swinging over it, that is the periurethral sponge, otherwise known as the G-spot. I like to call it the goddess spot because G-spot was named after Dr. Grafenberg, and he's a man, and I don't like naming female body parts after men.
What an ass.
I know.
Really?
Yeah. Yeah. So we're calling it the goddess spot, but it is the periurethral sponge that surrounds your urethra. So at 12 o'clock is your urethra.
Oh, so it's spongy tissue.
Uh-huh.
Urethra is passing near the basically right under the skin of the upper vagina, right there. And so the urethra is passing, and there's a spongy. Is it like to protect the urethra there, or what's the spongy material do?
I mean, yeah, it definitely like protects it.
Yeah.
For sure. It adds a little bit of padding, but it's also a pleasure spot. So it actually contains erectile tissue. So when people end up squirting, right, that is the tissue that ends up filling with fluid.
Oh.
And that's why it exits out of the urethra. It's not squirting like you're not squirting out of the vagina. You're squirting out of the urethra.
Where does squirt come from?
From the periurethral sponge.
But where is that? Where does it come from?
It's coming
there?
from the blood vessels. So this is why it's so important to wait for that buildup, right? Because if you're not built up, you don't have
But
all
it's
that
liquid.
blood
It
flow
can't
there.
be coming from the blood vessels.
Yeah, it's liquid from the blood vessels. Like the capillaries end up expanding, right? And I just have to show you this picture. We'll clip in a picture maybe.
I'd like to do that. I'd like to see this.
Yeah. It's really interesting. If you're curious about it, I read this and saw this in one of the best books for women's anatomy. It's called Women's Anatomy of Arousal by Sherry Winston.
Yeah.
She just lays it out beautifully and like takes you on a journey herself, like, but just in book form, right? So you're reading this and you're kind of getting to know this, and then she guides you through your reading. But it is a practice that you can kind of incorporate if you're curious. But the imagery that she has in there is really interesting because like the blood vessels are right next to these other vessels, and basically just through like, I don't know, for lack of a better term, osmosis.
Yeah, so kind of like filtering through.
Yeah, like I'm forgetting the word, but like not a serum, but you know when they spin your blood
Like
and
a centrifuge?
yes, and so what are they pulling from that? It's like
Like where they play
plasma. Thank you. It's like plasma.
It's like plasma.
Yeah, but it's another word for it is amrita. And that is like sweet nectar in Sanskrit.
Oh, sweet nectar.
It is sweet
Amrita.
nectar. Yeah. I don't know if you caught this when did you ever watch Avatar?
What is that, a movie?
Yeah, Avatar? The Way of Water.
I didn't know Avatar was a movie. I thought Avatar was just like a little being, like an avatar on a screen.
Oh,
damn! I
it's
missed the
that
base
too.
of it.
It's that too. So no. In the second Avatar movie, right, The Way of Water or whatever, the special thing that they were all after was like this thing inside this giant whale animal, right? And it was called Amrita, and it was in their brain. You had to kill the animal to get it, but they named it Amrita, which I thought was so interesting. Like, oh, you're bringing in this Sanskrit word. But in any case,
Sweet nectar.
Yeah,
So how
sweet
big is this?
nectar.
How big is this area?
I think it can be as deep as 2 inches.
Yeah.
It's not that wide. Like, because remember, we're working in a really small space.
Yeah.
So it can vary. And it will feel different when you're aroused versus when you're not aroused.
When you say it's erectile tissue,
Yeah.
you mean that like that spongy tissue itself
fills
has-
with blood.
Oh, okay. It fills with blood.
Like an erection.
Okay, like an erection.
Yeah.
It feels like a penis would, like the head of a penis.
Yeah.
It fills that area fills with blood.
Yeah. And same with the clitoris, which has legs that goes down the side of the vagina.
Ivy showed me that. I didn't realize those legs go so deep.
And the bulbs. The bulbs, too,
I always
on
thought
either
it was
side.
something the size of a BB that I'm chasing around.
So the next time, so say you're not aroused, or say you have a partner who has a female body and they're not aroused, just gently like pat or cup their vulva and see and notice like how flat it is. You can actually feel like sink past that tissue and feel like muscular attachments, like groin. You can, just like notice the difference, right? Then wait till they have had 20, 30 minutes to feel aroused. Get that blood flow there. Maybe they have an orgasm, maybe they don't. Come back and feel that difference. It is so puffy,
Yes. Got it. So that puffiness is coming from
the erectile tissue.
in both internally and externally. The clitoris is a nerve,
It has 8,000 nerve endings.
but it also is erectile tissue. The clitoris itself. Wow.
Yeah, it fills up too.
Interesting.
Which is why it's like it has a clitoral hood, right, that goes over it. When you are aroused, the hood kind of pulls back and the clitoral head peeks
the
out.
erectile tissue contracts and pulls it back.
Yeah. The womb itself also lifts itself out of the way. So say you're someone who has
When we say the womb, you mean the uterus?
the uterus, yes. This guy.
It lifts itself. It lifts itself.
Yeah.
I know it has like suspensory ligaments.
Yeah, it has suspensory ligaments, and it's almost like, sorry, imagine, like if you were someone who did have pain with deep penetration, and I know maybe if you're a male and you have female partners, maybe you've heard that before, like, ow, you're going too deep, especially in certain positions like doggy style. But it's almost like you're banging on the cervix and or almost like the posterior pelvic floor muscles. I wonder, like, this is where I would challenge someone. I'd say, okay, well, did you wait 25 minutes or so to find that expansion and find that release? Because it does, again, it takes time for things to shift.
The womb lifts and
Yeah,
then the
with
cervix
that-
goes with it.
Yes, which lengthens out the vaginal canal and creates this space for reception.
Fascinating.
Because that's the thing, she's meant to receive,
Right.
right? She's meant to receive penetration.
Yeah.
And I think if we just honor our physiology sometimes.
Right. The way it works.
Yeah.
From the factory. This thing's designed to operate a certain way.
Exactly.
It may not be the way that many men want it to operate, but you can't deny the way something is built from the factory. It's built
and in
to
the end,
teach patience.
to teach patience, yes, but right, like the patience is rewarding.
Right.
Because in the end, who gets the most pleasure? Both. It's not one or the other. It's both. Because too, when the clitoris and the legs and the bulbs are all like fully engorged, right? It creates a little bit of friction. So it's not like flat tissue that someone's going in and out of. It's like puffy tissue that creates a little bit more of this like nice hug for everyone involved.
Oh, wow. I never thought of it that way.
Yeah.
It's like foam. It just kind of like squeezes around, but it's like really nice foam that doesn't exist. You can't buy this foam.
It's mystery foam. But it won't be a mystery if you just map and spend some time with it. But yeah, it's interesting. When you are mapping by yourself, it doesn't have to be like a fully, like my goal is to be aroused and then I'm going to have a big ass orgasm and I'm going to come and blah, blah, blah. It doesn't have to be like that, especially if someone is dealing with some sort of trauma or they're trying to overcome some sort of pain or scar tissue. Anything like that, I would then just kind of take that pressure off of you to find pleasure, even taking the pressure off of you to find pain, and just be with the experience and see what comes up.
That's really nice to hear that, because like you can put a lot of pressure could be on the woman and the man going, okay, we're going in this for an orgasm. That's why. And then what you're saying is let's go into this thing differently. Let's go into explore, to understand. To sense tightness, pain, uncomfortableness, and then to really get to know that. And then if orgasm pleasure happens, then so be it.
Yeah.
But it's not the intention.
Right. Because sometimes I think
mapping.
too, exactly. I mean, I think sometimes what happens is a release. And the release can look like pleasure. It can look like an orgasm. It can look like squirting. It could also look like laughter. It could look like crying. It could look like just a deep sense of whatever it is you're feeling, whether that's grief or happiness or joy, whatever it is.
I've witnessed every one of those.
Yeah, right? And I think that's incredible. That just speaks to the range of the human experience and also speaks to like what we carry in our tissues, specifically in this tissue area in the pelvic floor that is maybe it's got some other things attached to it.
Do you know what maybe is held? Because, there's different, maybe in ancient Chinese medicine or different practice, spiritual practices that like maybe traumas are held in different areas.
Yeah.
And is there anything specific that comes to mind in the pelvic floor that's held there more than obviously maybe sexual traumas?
I'll speak to one right off the bat because it's just like it applies to men and women. It can apply to anyone. What I've noticed is a lot of posterior pelvic floor tightness. And Tammy Lynn Kent, I don't know if we've talked about her before, but she's a pelvic PT. She's holistic and she does a little bit more on the energetic side. And so what I've learned from her book, Wild Feminine, is incredible, but I think it applies to anybody with a pelvic floor. That backside of the pelvic floor can symbolize support, but it could also symbolize fear. And then when you think about the tailbone and what it does when someone is fearful, but if you even just think about a scared dog and how it tucks its tail, right? It's like tucking so that it can protect its internal organs, and tuck under so that, I don't know, no one can get in there, right? But that fear, and say you're experiencing some kind of fear in your life, or you feel like, there's not a lot of support in your life. I notice that there's a lot of tension carried in the pelvic floor on the backside.
On the backside.
So between 4 and 8 o'clock.
When you say backside, that's going to be the side closest to the back of the
Tailbone.
Tailbone. Okay,
Yeah.
got it.
Yeah. On either side. And that would be at any depth. It would be superficial, but it could also be really deep. And I think a lot of people end up carrying their tailbone in a little bit of that flexion. So it's my advice, or it's kind of like my prompt for people. Like, imagine the tailbone just kind of sinking down, like as if it had a little anchor attached to it, and it can just soften towards the table or the floor or the bed or whatever that we're on. And I just notice that everything on the backside dissipates if it's tension or if it's pain. But that's something that I'll inquire about while I'm working internally. I'll be like, okay, like let's.
You have them like visualize the release of something.
Yeah, totally. And it always pairs up with some other thing that they're experiencing in their life, whether that is constipation or like some external thing happening, right? Like maybe they are scared they're going to lose their job, or they're losing their partner, or they did lose someone and they have fear around what's going to happen next, the unknown, moving houses, moving states, whatever it is. It's very fascinating.
I've witnessed that firsthand doing like Landmark Forum and ALA, like these. I've seen and I've heard the stories and been with people who've had pain in different areas, and after they release something in their past, they're like free from it. Not a single move you fucking exercise.
Right?
I go, damn it, this changes everything.
It does.
Yeah?
It does.
There's the power of like, and I do believe now that, when I'm in school, and when I was in school, it was a competition. It's like, oh, it's Gonstead adjustment versus Thompson drop. Which one's better? And then it's just like, I don't know, the more I've been doing this, the more I'm zooming out on things way outside of that.
Yeah.
Into energy, into past life traumas of how those can carry over into
absolutely
the person today.
Absolutely. Like, okay, so for myself personally, right? Like, I feel like I've carried a lot of the things from my generations past. I actually did work with someone who does Psych K. Have you heard of psychology or psych kinesiology, something like that?
I have heard of that.
Okay. So like they basically test your nervous system for like truth, right?
Yeah.
And she tested like my arm strength and like what felt true for certain things. And we found out that my body was carrying nervousness and worry for 10 generations on my mom's side. And I was like, that's interesting. So I was working with that a little bit. But what I noticed that is like a lot of my left-sided issues. I have like left SI issues on occasion. And I feel like it was always tied to just this general sense of worry that I always carried with me. But the more I understood it and the more I worked with it, the more that went away. And I don't have that anymore.
Dolores Cannon, you heard her?
No.
She's a past life regressive hypnotherapist. She's created a method, and it goes back to when I did a 10-day silent retreat learning about Buddha. And Buddha said he saw hundreds of his lifetimes in his past.
Wow.
And that's when I kind of got a taste from like, what? And then, but now Dolores is a past life regressive. So she goes way, way back. She's dead now, but she's got like different practitioners that
have studied underneath her.
And I had one that was not a good experience. Nothing happened with me. I was just laying there for like 2 hours. He's like, go back.
You have no past lives. This is your first time on planet Earth.
He's like, go, what do you see? I'm like, the back of my eyelids.
Oh my gosh.
Yeah, it was not.
It's hard to drop into those moments. I can
how to drop
relate
into
with
those.
that.
Maybe I was with the wrong person, I think.
Maybe. Yeah, you definitely have to find the right practitioner. Same way you have to find the right everything for you.
Yeah.
Right.
But I think so being open-minded is being open to all of those things rather than just be so shut.
Right. Well, I feel like the more like you and I have just been in our work, and it comes from maybe like a Western kind of style of learning, and they kind of keep you like very segmented, and you're just going through this flow. When all of a sudden you meet all these people, hundreds and thousands of people,
and have other testimonials and these amazing experiences that aren't within this Western scope.
Right. And I think the more we appreciate some of these things, and not that we're trying to appropriate anything or like pick and choose, but you can definitely start to see like the map of how it all kind of fits together. And that's what I really appreciate about Tammy Lynn's work and putting the energetics into the body. But it's like the same thing, like you mentioned, traditional Chinese medicine,
Sure.
all of that.
Have you seen this giant health map? Have you seen this thing?
Yes.
I have it in here.
Yes, you showed it to me.
It's like a 4-foot poster.
It's amazing.
And it's a chart that goes arrow. I have the frame. I just haven't put it in the frame yet. But this thing is like literally, it takes you down Western medicine, it takes you down Eastern.
Yeah.
It takes you down all these paths. I don't even know the end of it yet.
Right.
But that's what makes the body such a mystery in this and our life such a mystery. I think the people that try to confine it to one thing, it's just, first of all, it's just so close-minded. It's just such a limiting way of looking at things.
Yeah.
Maybe they're afraid to go further, but I'm telling you, it's super exciting out there.
Yeah, I agree. I feel like I've been so blessed to be able to expand the practice, and like I was really grateful for the training that I got and you know, just the work opportunities that I received. But I'm so glad I just like kept following my curiosity.
Yes, wow.
And it's like led me to this place here, right? Where like I feel confident enough now to be like, I'm going to guide you in a mapping session, which sounds so bizarre, I think, to some people. And yes, they still, you know, potentially think it's just
I don't think mapping's bizarre. Well, at least from an anatomical standpoint, it makes sense.
well, yeah. So that's kind of like, this is my little trick, I guess, the subconscious trick that I've made is like, I can get people to trust me because I'm a pelvic physical therapist and I'm going to teach you anatomy and everything. But just so you know, like, it's not just that we're working on. It's energetics. It's all of this thing. It's like literally how I've been seeing it. And what I'm going to be putting out soon is this course that will incorporate some of this mapping practice, a lot of meditation. I'm a yoga instructor too. I don't know if anyone knew that. But I want people to realize that you can use your body to alchemize the shit that's happening in your life.
What does that mean, alchemize it?
It means you can transform, say like you have trauma, you can transform that trauma into something better for you. It's not something you have to live with. It's not something you have to identify with all the time, but you take that and you almost like burn it up, let it like rise like a phoenix, like something else in your life, and your body's better off having done that.
That was a trademark. Back in the day, I trademarked transform pain to power. And I trademarked it, and then I was like, transfer. No one gave a shit about that. I'm like, I just paid money to trademark this shit. Nothing? Then one time I said, fix your shit. They loved it. I'm like, what the fuck? But yeah, because you could like use it, like any kind of pain, you could, this trauma happens. There's people, everyone has a reason why. Like you could be miserable because of an event, but you can also use that same event as you can also be super successful because of an event.
Absolutely. My mom was like basically the most trauma that I've ever seen in someone like super close to me, right? Like she grew up in Cambodia, had to escape the Khmer Rouge, all the communists, and she was a prisoner of war. It's crazy.
Damn.
And she was, you know, in her teens. She was 15 to 19. She was 19 when they got out, and her 4 siblings and her mom survived, and they came over to America. She was like, at 8 years old, though, she had seen Neil Armstrong walk on the moon. She's like, I want to work with that. I want to do that. She is a rocket scientist now.
Really?
Yeah. And she's just taken
Your
all
mother?
of this. Yeah.
Where does she live?
In Pasadena.
What's she rocket sciencing?
I'm not allowed to discuss.
Really?
She works for the government.
Oh.
But yeah, so she's taken something so adverse in her childhood. And sure, she's not perfect by any means, but she's taken her life and she's just used it to catapult herself and like motivate herself to have the best life that she could possibly have.
I love that we're bringing this, talking about this, is because so many people they have this story that they've created about why they're in pain, and it makes so much sense.
And
no one's going to argue with it.
It's important to hear the story. It's important to hear the story. Give it some space. Give it some room to breathe. I think so. Like for me,
I listen to it. I'm like, oh God.
Well, you should hear some of the birth stories that I hear.
Oh, right.
They are incredibly gnarly. Some of them are just like, a doctor said that to you? A nurse said that to you?
The more I'm in this, I'm like, that birth is fucking traumatic as shit.
It can be a lot.
Holy crap.
It can be a lot. Luckily, I feel like I'm not bombarded with a lot of negative experiences.
Yeah.
am so lucky that I have clients who are like, I wanted a beautiful experience and I got it. And yeah, sure, it was painful, but again, it's alchemization. Like you're literally transforming from maiden to mother or whatever. And it's like a beautiful experience for them that they appreciate. And like we can hold space for some of the other shit that might have gone down. Like maybe they did have a tear, but it doesn't, it's not something they resonate with.
Yeah, like the way you plan what birth is and visualize it for the woman. It can often predict the outcome of that thing. If you're like, oh God, I'm pregnant, this is gonna be terrible. Well, then there you go. Now you're in the hospital, and then you just inadvertently make the choices to equal the experience that you've made up it to be often.
Right. Right. I mean, I think doing mapping in that late stage of pregnancy is so key. Like, because if you don't know your pelvic floor and you don't know how to breathe with it, you have to learn how to yield. Like you have to learn how to relax your pelvic floor if you're someone who does have that like tight tailbone and you're scared. And of course there's fear with everything that comes through, like all the contractions and just all of the things that happen during a labor process, right? And they do place a lot of fear on you sometimes, like when it comes to the baby's health and the mother's health and everything being at risk. But if you don't know how to breathe and exhale and yield to let the uterus do her thing, because she's the one that's literally pumping the baby out.
What is kind of the basic, maybe labor breathing techniques? Does it also overlap with just breathing techniques that we should be practicing anyways, just applied to birth?
Yeah. I mean, it's like I separate into two different sections, like how our pelvic floor works when we're just breathing normally and living our day-to-day life versus how our pelvic floor works when we are pooping or giving birth. So generally speaking, when you inhale, pelvic floor comes down, diaphragm comes down.
Pressure goes down, pushes it on.
Right.
The diaphragm goes down. The pelvic floor goes down, not
TA
from
goes
a
out.
contraction, but just from pressure in the abdomen, causing the downward pressure.
Right. And I like to say, like, there's just a little bit of a descent, right? It's not like you're bearing down. This is different. Like bearing down is different.
How much descent there is? Do you know?
Millimeters?
Yeah.
I don't know. It would be interesting to look that up exactly, but that'd be hard to measure on every one.
How do you measure that?
Yeah, especially with positioning and da-da-da. So anyways, when it goes down, diaphragm comes down, TA comes out. When you exhale, reverse happens. Diaphragm comes up, pelvic floor rebounds back up, and TA comes in, right?
Yeah.
So that's inhale, exhale, inhale, exhale.
Let's be clear. That's we call it proper breathing.
Yeah.
That's
ideal.
That's ideal breathing.
Yeah.
Not everybody's doing that. It's not like, oh, that's how I breathe. That may not be how you breathe.
Yeah. So how I teach my clients for when they're going through the labor process or they're trying to initiate a poop, it's going to be inhale, TA comes out, diaphragm comes down, pelvic floor comes down still, right? And then when you exhale, pelvic floor stays soft. Stays soft or lengthens down. And TA comes in.
Oh, interesting. A conscious relaxation or slight descent of the pelvic floor.
Right.
Through.
Yeah. Because to me, the pelvic floor is like a trampoline. And this is what I see in most of my clients, whether they're prenatal or they had some sort of trauma or they're early postpartum, like 8 weeks. I work with clients who are earlier than 6 weeks. I just don't do the internal work, but I'll look at their vulva with them and watch how their pelvic floor is doing and moving. But when we are getting to the internal stuff, it's actually really interesting. I feel like if the pelvic floor is a trampoline, a lot of them have a ton of springs around the trampoline. So then when we talk about something like stress incontinence, where there's leaking, unwanted leaking with coughing and sneezing and laughing and jumping and returning to running and all that kind of stuff, or you just have the big pressure of a baby on you still, it's like, okay, the trampoline's not moving. The springs are all there. And so when the big pressure's coming down, the fabric's breaking. And that's
because
what's
it's like,
leaking.
it's actually at like maybe a full, it would be at, if it's overly, I guess we can use the word, the longer I do this, the word tight and weak, I know. They can get so complex. Because like a muscle can be tight and weak.
Exactly. That's how usually the pelvic floor is. Like she's just so fatigued from having done everything and she's feeling really tight and guarded, rightfully so, if she's trying to hold on to a baby
if she's guarded,
still.
she's up.
Yeah.
Right?
Yeah.
She's up.
Uh-huh.
Okay.
So
that guarded position is up, and you're saying if it's guarded up and there's pressure down, there's no spring.
Yeah.
Well, the springs are at full tension.
Yep.
So
exactly.
now that could cause things like tearing,
Yes.
strain.
Yes.
Because it's not trampolining.
Yes, exactly. There's no resilience. There's no reaction.
Right.
So
So
actually
rebound. It's like your shock absorbers in the car. It's like them being stuck in the, well, it would be like stuck in the highest position, really.
Yeah. So what I like to think about with wands is wands are the thing, or fingers are the thing that is undoing the springs. And then once you gain this newfound range of motion, you're training that range of motion with your breathing. And at different stages of the pregnancy and then in different stages of postpartum, that breath work changes. And we don't have to get into all that because I feel like everyone is, it's definitely specific person to person. But generally speaking, right, like having that newfound range of motion, you're going to want to train that. Like
So you want to repeat it.
In
You
all
want-
different
you want to
positions.
repeat it so it sticks.
And to come back eventually to this like ideal way of breathing and the ideal way of being with your pelvic floor.
Is it possible with the pelvic floor, is like if I contract my pelvic floor, everything seems to contract as one. It seems to contract as one.
That's interesting that you asked that or talk about that. Because sometimes
Can I control my whatever the fuck this little one is here?
Yeah, so I like to call we're talking about these little muscles that are close to the pubic bone, and they follow the ramus here out to the ischial tuberosities on either side. I like to think of them as like the A-frame muscles, and then you have the ones that kind of go down and around and surround the urethra, surround the vagina. These are the ones that are usually the most quiet on people who do complain of incontinence issues.
The most quiet and the most inactive?
Yeah. Yeah. And these ones on the back side, the 4 to 8 o'clock, those are the ones that are super active. And
I have
they know
these?
how to do that. Yeah, you have these guys.
Huh.
Yeah. So what I tell people is if you are experiencing that kind of symptom, like incontinence, urinary incontinence, and say you have already done the wand work, you've got the range of motion, this is how you're training it then. I want you to think about doing a Kegel, but specifically, this is what I say. Like, imagine the A-frame muscles kind of like closing in and curling up and through the vagina and pulling up.
That's the move. Okay. In a way, it's like contracting the arch of your foot. You got this like.
Yeah.
You got this.
Which is so hard to train sometimes.
It's so hard. Like the arch of the foot is probably the most frustrating. You have a really good grip. You still have the best arch grip foot. I still watch that video. I'm like, that is a good fucking foot. Damn. It's hard to get. My left one's coming around. But the movement is like, these movements can be, it almost just goes like, if 10 is a perfect contraction when I teach people like foot and probably this, it goes 0, 0, 0, 0, 0, 0, 0, 0, 0, 0, 0, 0, 10. It's like, and then they get it and they get it.
Yes. Yes. It's the same thing. So I think the tactile cueing, like whether using your finger or a wand if you're by yourself, right? Like that helps people a lot. And you can
what does
feel
it do?
this
It looks
muscle.
like it squeezes. It looks like it closes the vulva.
You can, I'm like literally touching mine right now. Like you can feel it externally. And it's like, what I also tell people is that when you do it and say you're not wearing pants and you're in front of a mirror, you might notice that the tissue up top by the clitoris actually like winks down at you.
When you contract it.
Yeah.
So you can get some visual. You might be able to get some visual feedback.
Because
Tactile
most people
always.
are always looking at the perineum. They're looking for that perineum puckering up and in. But what I'm looking is for movement at the top.
What do these muscles do? It looks like they close. It looks like when they squeeze, there's like it almost like a bag, and like you pull it apart, it cinches it shut.
Yeah, exactly.
Huh.
Yeah, like.
So you're saying these are possible to contract these without contracting these?
Yeah, I do that myself.
Wow.
I can you can do the front ones, and I think eventually, the back ones kind of turn on to help out too. But you can be really specific.
I got some front action right now.
There's like an articulation that can begin to happen when you are aware of your body in this way. Like it's not just one major and letting down. It's like, you can. It's almost like contracting your left butt cheek and then your right butt cheek.
I was thinking similar. So I was thinking even like transverse abdomen. It's like when I teach people like snap back, they go, that's it? I'm like, well, that's like 10% of the muscle.
Yeah.
You're just trying to pull back a little bit. When you get good, you can pull it all back.
Right. And it's like people, like you think about like Alia, someone like Alia who can do the Kriya going left to right. That's like the kind of, I mean, I would love to be able to say I could do that vaginally, but people can do that and people can
with
feel
her
that
abdomen?
vaginally. Yeah.
Oh yeah. Oh right.
But you can almost go like left, right vaginally. I'm like, I can't, I'm not there
Wow.
yet. But that's what people train for with like yoni eggs.
Yoni eggs.
Yoni eggs. Yoni is a Sanskrit word for like all of this
All that,
area.
yeah.
Like pussy,
Yeah.
basically, but Sanskrit. And eggs are like crystal eggs.
Oh, yoni eggs. Okay, got you.
Yes.
Okay.
Yes. I
And
should have brought all the props.
You
Damn
should have
it.
brought the props.
What was I
It would
thinking?
make a great cover image. Look at all this shit. Okay, so here's what I'd like to do. I'd like to go back into this mapping a little bit and like complete this.
Yeah.
Okay, so far we've got to the
Oh, the 12 o'clock.
we got 12.
Okay.
We also got a little posterior, but not so much.
Yeah. So I'd say how I like to do it, how I like to train someone into it. And like really it is a mindset thing too. Like it's a vibe to be in a mapping vibe, right? I have them go and work down just one side and it's like you're kind of swiping
Externally.
or like stroking, petting, whatever you want to say with your coconut oil, whatever oil you want to use. And this is external. So we are starting to differentiate right between the external genitalia and the internal genitalia. At this point, it's like you're just working the outer labia or labia majora, but it's not always the bigger one, right? It's the one with hair. And then we'll kind of work that and go in circles, different touching techniques basically. And then I'll have them go on the left side and do that same thing. And then we'll go feel around the clitoris on either side of the clitoris and just recognize where that clitoral head actually lives, right? Because you can actually feel almost like the clitoral shaft, right? The neck. And then we'll go pick one side, whatever, going down and in, and we'll feel at all the little points with different touching techniques. So whether it's just like the present pressure or it's like small circles and working the way around, I invite those like energetic questions and inquiries as well when we start doing that. And then we'll make our way all the way down towards 6 o'clock. Once we get there, we switch hands and we do it again.
Other side.
Yeah. And then we can go in deeper. Of course, you can go in deeper just with the finger and do that same motion, same thing on either side. And then if you wanted to go explore deeper, that's when I'd invite you to bring
When you
your
say
wand
same
in.
thing, what do you mean? Do you mean like kind of like circling,
Yeah. Like,
starting with maybe an inch in
yeah.
and doing like
Like,
a full 360?
What I invite people to do is like the tip of the finger being the first thing, then the first knuckle, then the second knuckle, then the third knuckle.
Oh, those are your benchmarks. Basically, first knuckle, full 360, palpating along the way.
Yep.
Second knuckle, full 360. I see, got it.
Yeah.
Okay. I like that as a benchmark.
It's really, I mean, because then you can kind of gauge that for yourself.
Yeah.
You know? Yeah, so that's kind of just how I like to guide it. But it is like a very meditative thing eventually. And people, when they're done with it, it's like they come out feeling more peaceful, more grounded.
Like music recommendations, like really meditative.
I mean, yeah,
fucking
I've got,
flutes and
follow
little-
me on Spotify. You'll find all my playlists.
What is your Spotify?
It's my name, Brittany Ellers.
Okay, got
yeah,
it.
Yeah.
Uh-huh.
Yeah, I have a ton of mapping playlists on there.
Mapping playlists. Okay, that's great.
I don't have another sexy word for mapping. I'm like, it's just mapping.
Well, I think the word mapping is like you're trying to go, okay, we don't want to put too sexy of a word because it's really meant to like an exploratory session in your body.
Yeah.
And like you said before, it could turn into pleasure.
Right.
But it can also turn into something where you might find some new tender spots. And like, what are the common spots that during this mapping session that you find that the most common, maybe tender spots, painful spots that are felt?
Yeah, I'd say anywhere around the levator ani. So that would be like second finger or third knuckle in. Sorry, not finger. Second or third knuckle in.
Yep.
Down towards like 4 o'clock or 8 o'clock. Those ones are pretty tender for people.
Okay.
And then super.
So levator ani is a muscle that lifts the anus. So it's like a,
Right.
I think it's kind of like a
Sling.
suspensory sling kind of thing.
It goes from the front, like on the back side of the pubic bone, like so on the inside of the bowl, and slings all the way around the vagina and the rectum and connects to the tailbone.
Okay.
At different, layers. It's almost like a little fan. But there are some muscles in there that are a little tender for people. Superficially, it depends on if there's someone who has had, trauma or something like that. If they have tenderness around just like the bulbospongiosis and the cavernosus muscles there at the front. but also for the most part, a lot of people have spiciness at like the entry point with the fingertip going straight down towards the perineum. Because that is like a lot of connective tissue, right? It's the place that all of these muscles almost like congregate. And it's the place where people usually end up tearing in birth.
Oh, I see. Got it.
Mm-hmm.
Okay, it's a congregation point of muscles.
Mm-hmm.
That's going to be straight down. That'd be like
Yeah.
6 o'clock.
Yeah.
And what about any concerns? Like, because, you know, a woman might go, oh, my goodness.
I'm
This
so
hurts.
sore afterwards.
Or I need to go get an MRI. Like, well, what are the actual most common things that they might be sensations like that are unwanted sensations? The most common unwanted sensations. And what might those mean? And maybe even like what could be something maybe of concern?
That's interesting because how I like to guide it is I start them with a tomato touch, which is why I was like saying when I am working with someone one-on-one, I'm working with just the presence of my finger. I'm not even adding pressure. So I'm not going in and like breaking skin of any kind. I'm not trying to bruise muscles. I'm not like, you know how cupping leaves marks and things like that.
Yeah, you're tomato touch.
Exactly. So what I mean by that is when you're going to a grocery store, you're picking up a tomato, you're testing its ripeness. You're not squeezing it hard enough to like create juice and break the skin.
Yeah.
You're testing it just to see, right? If it's like juicy and plump.
Right.
So that's the touch that I start with. I wouldn't go any like harder than that. I wouldn't go any faster than that, if that makes sense.
By the way, any Door Dashers out there, you guys need massive training on tomato picking. Okay? Who the fuck grabs a bright green, hard as a rock, heirloom tomato?
Those are good. Green tomatoes?
Hard as a rock.
Pickle those.
Pretty, I'm not pickling shit.
Katie might.
I'll put it on the counter for a month, and a month later, it's still the same.
Green tomatoes, make them fried.
Oh, really?
Yeah. I'll
Fried
give you a
green
recipe
tomatoes.
after. Do a pickled tomato. It's so good.
You just put in vinegar?
Yeah, vinegar, water, a little bit of salt, a little bit of pepper, garlic, dill.
Pickled tomatoes? I mean, I like pickled anything.
It's so good.
Pickled garlic?
Yeah.
I love pickled things.
Yeah.
Really? Put tomatoes,
I'm a
pickle
fan
them.
of pickled. Anything fermented. Like kombucha, all the things.
Yeah.
That's us too.
New favorite kombucha, by the way. I've been a GT fan.
What's GT?
GT is GT Trilogy
Oh,
Synergy.
yes.
Synergy.
Yes.
It's still my, but there's this new one I gotta give you. Gotta try this before you go. It's like this can and it's like a blueberry.
Ooh.
What's it called? Bambucha blueberry tart. I drank and I go, oh fuck, what is this one?
Don't they have a brand that is alcoholic or no? Or is it just
I think they do.
non-alcoholic?
They might have an alcohol.
Okay. But I think I've had their mango one or something like that. Super good. I agree.
So you're a big fermented fan.
Yes.
I'm always like, does the fermentedness actually get to the gut? Does it get there? Or is it just destroyed by acid first?
It's a great question. I am not a gut
I know.
expert on that. I do know that some of that stuff, like the fermented things, at least helps with menstrual cycles in the follicular phase. So that's when I introduce that into my diet. But yeah, we're getting off course. So what other questions do you have about mapping?
Anything. Oh yeah, we're on.
Oh, we were talking about like
concerns.
Okay, so say you come out of your wand session, you come out of your mapping session, and you do feel a little tender, you do feel sore, and it's lasting a day, maybe a little more. You went too hard. Maybe you did it for too long. And I think this is where listening to your body really becomes important. She'll tell you when she's done. You know, like I feel like when I'm first working with someone, you just know. There's an internal sensation, like enough is enough. Like I feel it's like too much. Like let's even take a break and see how we feel without having something in.
Trust the intuition.
Trust your intuition.
If you're like, I'm done, I need a break, then take the break.
Yeah, exactly. I feel like, I'd start with maybe 15 minutes. But even if say you're a mom already, right? Or say you're a parent and you're kind of just like, I need something that's going to help and work quickly. But it's not a quick fix, but it's about being consistent. You could just spend 8 to 10 breaths on either side, just like stretching the perineum a little bit. And that would do some wonders for
8
some
to 10
people.
breaths
8 to 10 breaths.
with, are you talking with palpation, internal external, or just breaths?
Yeah. So like when you're like holding here at the vagina and you're kind of stretching out towards like the 5 o'clock or, the 7 o'clock, that basically, whoa, don't want to break her. When
Magnets.
I was going too hard, more than tomato touch. When you're stretching like almost diagonally around the perineum. So we're not like stretching this perineal tissue directly, right? Because that's connective tissue that she's not going to stretch as well as muscular tissue. So we're going to go on the sides of that. Hold for 8 breaths while you're in the shower. You're already naked, might as well. Then do the other side. Few breaths.
Hold for, okay, got it.
Okay.
You're basically applying pressure, pulling outward to get a little stretch, and breathing into that.
Yeah, exactly. I would breathe with it. Like, so every time you took a breath in, you're giving yourself that little stretch. When you exhale, just hold it there and see what happens.
I mean, how many of these natural birth tears that occur, what is your estimate on how many of those are preventable with the right?
Oh, I'd say almost all of them.
Almost all of them.
I think it's really gnarly that
The bladder's going to go down, by the way.
oh no. I think that I just read a stat about this. It's like 85% of first-time moms, people giving birth, tear. And I think that's absolutely preventable. And it's either with a grade 1, grade 2 tear, so not all the way back into the rectal area at all. That's grade 3, grade 4.
How are those tears in a nutshell? Obviously, breathing, you're doing internal work, but like what's the overall protocol for stretching that tissue to prepare for birth?
Okay, so we're talking like this hasn't happened yet.
Yeah.
Okay, so starting at week 36, 37, I'd start incorporating the perineal stretching 2 to 3 times a week minimum. And whether that's you by yourself, and if you're pregnant, you might not be able to reach to the front, so that's where I'm like, reach from behind and just stretch from behind. Or you can have a partner do it, or you can have a practitioner, a pelvic physical therapist do it for you and do it with you. There are a couple other tools out there that are APTA approved, which is the American PT Association. Like the PeriMom is a wand that's specifically meant for right-handed people. I tried it. I was like, I'm left-handed.
Oh, you're
this doesn't
lefty?
work. Like, I don't like it. But it's a great
Do they sell
tool.
a lefty version?
They don't. Not yet. So they're missing out on some people. Not the majority, but whatever. It has like a little
5%.
I know. It has a little groove for oil to come down. And so it can you're not having to reach directly to your vulva and the perineum. You just have it go down into the wand and it's like there for you already to use. And it's it's a good shape to be able to have like a broad stretch.
Okay, gotcha.
So I like that.
I figured I picture some sort of balloon or some sort of a inflatable.
Well, so that's what they do when you're in labor. They'll do the inflatable balloons to help dilate your cervix.
Oh,
but
it's
that's
for
not
cervix.
But yeah, that's not
okay.
to dilate your pelvic floor.
Got you.
Your pelvic floor is different. So yeah, I'd say that to keep it simple, right? Like 36, 37 weeks, 2 to 3 times a week, you're doing that kind of stretching. But you could spend up to 20 minutes doing it and even doing a meditation around it and visualizing your birth, visualizing your entire pelvic floor just softening and yielding to this baby.
Is there a measurable goal? Like if I'm doing bench press, I'm like, okay, I want to bench 300 pounds. Or if you're doing the pelvic floor, like, okay, I need this stretched out to the baby's fucking head.
Yeah. So some practitioners out there, I personally don't do this because I think it helps to have a little bit of the adrenaline and all the things that'll help you expand a lot quicker. But some practitioners out there will literally get you to experience a fist and before you give birth so that your nervous system and your tissues are aware of what that should feel like.
Got it.
Before it even happens. Do I feel like that's necessary? Maybe for some.
Okay.
I think it could be helpful for some, but it's not going to be everyone's goal. There are actually some really cool. I have a client who's given birth 4 times. The first 2 she did tear. The last 2 she didn't. For the last 2, she used this big dildo. Her husband helped her use it. It's called the Great American Challenge, which is, I think is just a funny name for a dildo.
The Great American Challenge.
Yeah. It is the size of my bottle, tall wise. I don't think it's as
My husband's
wide.
like, I'm intimidated.
It's tapered, like it's tapered at the top, right? So like you can take your time with it and
Shim
wedge
yourself.
it in. Yeah.
Yeah.
But like that's what basically a dilator is doing.
That makes sense.
Yeah. So you could do that. That's different. And I feel like just diameter wise, like a baby's head can be as big as a bagel or as wide as a bagel.
Oh, really? Is that about right? Well, as wide as a bagel?
Yeah. Like 10 centimeters is,
3.5 inches, 3 inches, something like that?
yeah.
Bagel size head.
Right?
Wow.
Bagel head. But yeah.
Man, I feel like we can go on for hours.
Of course we could.
Especially because now I've created different branches of this.
I know. But that's how this stuff works, right? It's literally like what we're talking about is like we could slap that on one of your maps. Like, you know what I mean? Like one of the, just connect it all together.
We really covered a lot of the mapping too, the importance of mapping to like explore pleasure, tender, pain, get to know. We talked about some different tissue expansion techniques and to like pull and to stretch. We learned some of the anatomy through here. We didn't talk too much about symptom. We talked about where some stress points are held on the body. We talked about kombucha. We talked about fermented tomatoes. We talked
We're talking about bagels, a lot of food and drink.
Bagels, food and drink. I'm actually hungry right now. That's probably why. So tell them, please, how they can find you, because you're really become. I'll tell you, I've just known you for like almost 5 years now.
Oh, I feel like, yeah.
Yeah, almost 5 years, and man, you're really expanding your knowledge. It's really beautiful to see.
Thank you.
Yeah.
I appreciate that
Oh my
so
God,
much.
you're speaking like everything is like you're really becoming an expert.
Coming into my own.
You're coming into your own. So I definitely want to recommend you to everybody. So can you tell them where to find you?
Yeah. So I'm most present on Instagram. That's b.ellers. And my website is wearebeingbetter.com.
We Are Being Better.
Yes.
Okay,
Being Better is the name of my company. I like it kind of, just open and widespread. But yeah.
Open and widespread.
Just like what's between your legs.
Just like there. Open and widespread.
Yeah.
Love that. Okay. And you also have some courses. You do one-on-ones.
I do one-on-ones through my Descend program. So that's like 4 sessions, 10 sessions. I treat
My wife is a client of yours too.
Oh, yeah. I wasn't going to out her, but.
Whatever. Wife. There's no HIPAA between us.
Yeah. Right. She gave you permission.
That's it.
I treat out of my house in Carlsbad. Or we can do online. So either way, I love doing this stuff online too. So for groups, I like guiding these mapping sessions. So I'll throw those out there every once in a while. I have a podcast. That's called the Pelvic Pulse podcast.
Pelvic Pulse. Podcast.
Pelvic Pulse.
Okay. Guys, for more information, just go to our website, okay? If
Yeah.
you guys leave comments, where is the podcast? Like, go to our website.
Yeah.
It's 2024. How do you not know how to find
Like
people?
go to my link tree. Like my link tree has it all like splayed out. It's
I talk
perfect.
about the membership, and they're like, where do I find it? I'm like, have you considered looking at the link in our bio or checking out MoveU.com?
Yeah, I don't know.
Pay tens of thousands of dollars to this website
This
to make it
is
easy
why
for you.
ManyChat does such a good job and exists, right? It's like you say a word and then they send you the link or whatever, and it's like people just want the link sent to them versus them seeking it
I'll
out.
tell you this: the longer I've been doing this, my patience with society is it should be like
Yeah.
if I was Buddha-like, it would be actually increasing patience and love. But I've noticed my patience for just it's just on the decline. I'll tell you. So if you want. Today is always the best day to give me my calm states, basically, is what I'm saying. Okay? So if you think I'm angry now, tomorrow, that's just so you know. It's a decline.
Today's the best day.
Today is always the best day to get an answer from me.
Stay in the present.
That is it, in the present. Well, thank you.
Oh, thank you, Dr. Mike.
Oh,
this is
my
so
God.
fun. I
always
love being here.
Oh, I always love working with you.
Yeah.
You're my favorite educator, by the way.
Yay.
You are.
Thanks.
Oh, my goodness. I love being a director when you film, too.
Thank
you are so animating good at camera. I cannot even tell you in words.
The camera loves me. What can I say?
Thanks, everybody.
Bye, everyone.
Bye.